To our January 27th Douglas County Board of County Commissioners business meeting. We want to welcome any of you who are at the Douglas County Courthouse or joining us online. Do just want to pass on a bit of information regarding how we'll run our meeting on Zoom during this time of social distancing. If visual aids are used during the meeting, the presenter will share the screen with the call. Participants will not be able to view them without a computer, smartphone, or tablet. All participants will be entered into the meeting with their audio muted, meaning the commission and the public will not be able to hear you. Presenters will be unmuted when their agenda item comes up. We ask that all online presenters use good conference call etiquette and mute their line when not speaking and introduce themselves each time they speak. If you have public comment on an agenda item or under regular public comment, please use the raise hand function on Zoom. Staff will call on you and unmute you. We ask that speakers give their name and address for the minutes. The county reserves the right to shut off the microphone and remove any speaker from the meeting if they are vulgar, rude, or inappropriate. The chat function has been disabled and a recording of this meeting will be available on our website after the meeting. It looks like our first item of business is a proclamation for Human Trafficking Awareness Month. And is Will Averill with us?
So commissioners, we did not see Will in the chat. We weren't sure if Catherine perhaps was here to receive the proclamation on his behalf.
Yes, I am here. I'm Catherine Pohl.
Thank you.
Fantastic. So do I now read this whole proclamation?
So yes, traditionally someone on the commission, and often you take turns, volunteers to read the proclamation, and then we generally allow anyone here who's here to receive it to have just a few comments.
Fantastic. Would anyone like to read this proclamation? I can go ahead and take this first one. Okay. So, Proclamation of Human Trafficking Awareness Month, January 2021. In Lawrence, Kansas and the surrounding areas in 2020, there were 44 identified survivors of human trafficking. Survivors of trafficking are among the most vulnerable of individuals, and we must work together to address the root causes, as well as create sustainable recovery options for those who have survived these atrocities. Survivor perspectives are important to solving the root causes, and it is important to include survivors to keep those survivor-informed perspectives in the forefront of initiatives. Organizations who are taking the lead on human trafficking initiatives in Douglas County, Kansas include, but are not limited to, the following: Youth Trust Project, survivor-led; Lawrence Police Department; Lawrence Anti-Trafficking and Education Task Force, LATTE; the Sexual Trauma and Abuse Care Center, Bert Nash; LMH Health; Lawrence Community Shelter, University of Kansas; RADAC, Lawrence School District number 497, and the Willow Domestic Violence Center. Whereas human trafficking, a modern form of slavery, is one of the largest and fastest growing criminal industries in the world and is based on recruiting, harboring, and transporting people for the purpose of exploitation. And whereas sex trafficking and labor trafficking occur in Kansas and in both adults and children of any gender, socioeconomic status, age, race, sexual orientation, or geographic location can become victimized. And whereas human trafficking, including sexual, verbal, emotional, economic, and physical abuse and exploitation, and all forms of abuse carry long-term complex trauma implications. And whereas Kansas human trafficking laws define commercial exploitation of children, which does not require showing of force, fraud, threat, coercion, and references to the existing statutory definition of human trafficking and aggravated human trafficking. And whereas the effects of human trafficking reach far beyond its victims and perpetrators, causing disruption in our schools, places of work, and neighborhoods. And now, therefore, the Board of County Commissioners of Douglas County, Kansas do hereby proclaim the month of January 2021 as Human Trafficking Awareness Month, and urge the citizens of Douglas County to speak out against sex and labor trafficking and exploitation, to support survivors of these heinous crimes, to encourage community leaders to hold offenders accountable, and to make preventable efforts a priority by hosting events, by creating policies at work, school, and home, and by supporting and participating in programs designed to reduce and eventually eliminate human trafficking as a social problem. As a community, we will support creating and executing a comprehensive, collaborative, and trauma-informed response for the safety and security of human trafficking survivors. Adopted this 27th day of January 2021. And Catherine? Would you like to add anything?
Yes, I just want to thank you all for having me here today. And I am the Human Trafficking Program Coordinator at the Willow Domestic Violence Center, and I serve Douglas County. And it is an honor to be here today and to have this proclamation for 2021, because this is such an important initiative, and it is such an important thing to bring awareness to. And the first way to bring awareness to it is to talk about it and to recognize that it's happening in our community and it's happening to our citizens every day. We serve many survivors of human trafficking in our community, and this is the first way to kind of get it out there. And I just want to thank you all for having me. And thank you all for speaking out for our survivors in our community. It's just such an important thing, and we hope that through all of our awareness in our community, through working with our partners in the community, every one of them that you listed, and even beyond that, that we can continue to combat this and to let people know that it's happening, and how to recognize it, how to recognize signs in our community, and how to work on prevention and be the forefront of that, and report it when we see it, and let people know that we are available for help, and we're available for education in the community. So it's not just helping our survivors directly, but it's educating different community partners, educating our children in our schools about what to look out for, and how predators find victims and what they do to manipulate and coerce people in our community. So thank you so much for having me.
Thank you very much. We do really appreciate all of the work that you do at the Willow and all of the partner organizations.
Thank you.
Commissioner Portillo, can I ask a question real quick of Catherine? Would that be okay? Catherine, I noticed last year that there were 64 identified survivors and 44 this year. So on one hand, we could say we're doing a better job of recognizing that, but I would be interested in your perspective on how COVID-19 has impacted. I mean, there's 20 less of your recognized survivors. So do you have any thoughts on that?
Yeah, I do. I think that through COVID, we've had a lot more, I've had a lot more referrals for human trafficking survivors, but most of them have been out of our county. What we see with human trafficking survivors is that relocation is often the safest option for them. And so a lot of the calls that I got from crisis were other organizations calling me from outside of our county. So I think overall, from my perspective as a survivor working, or as a advocate working with survivors, I saw a significant increase in human trafficking survivors through COVID. But when they're coming from outside of our service area, sometimes, if we don't have a place for them to be safe here, I'm going to find the next option for them. And so this year through COVID, we've connected with so many different organizations throughout the United States to relocate people safely, and to make sure that they can get out of the unsafe environment for them, but be able to be housed when they get relocated, and not be still so vulnerable to traffickers, being homeless and with the health crisis. And so I think through COVID, there has been an increase, but a lot of it, as far as our numbers go, it isn't really showing that because we haven't directly served those survivors necessarily, but that's still a huge number for our small community. And a lot of those survivors, especially through COVID, it was even more difficult because not having group living a safe group living environment because of COVID. It just made it so much more difficult to serve our survivors, and obviously the money, the financially, it's been difficult. So I think that we are, as a community, talking about it more, which is so wonderful. And I think that has helped the referral process because as the Willow, we're not just seen as a domestic violence shelter, that we're seen as helping human trafficking survivors. And so, yes, the number has decreased, but I think overall through COVID, there has been an increase. Just more of the referrals have been outside of our community.
Thanks. I appreciate your perspective and for taking that question. Thank you.
Of course.
Any other
I don't-
questions or comments?
Excuse me, I don't have any questions. Commissioner Reed here. I just wanted to say that Catherine is a favorite coworker of mine. So I'm privileged to get to work with her and so many other advocates that serve survivors of trafficking at the Willow. But I just really want to highlight the work that all of these agencies listed in the proclamation do, and that when we started the human trafficking program, I don't really remember how many years ago now, but it was completely foundational to have so many agencies that were intersecting with it involved. And it's been a really powerful example in our community of how we met a need that was not being served very effectively or with any continuity. And all of these agencies that are dealing with the intersection of domestic violence and sexual violence and child abuse and other and substance use disorders, that all of those are key components. And it's just a really powerful example of how collaborative all those agencies have been in making sure that people have various points of access to the resources and supports they need. So thanks for joining us, Catherine.
Thank you so much for having me.
Thank you. And we will move to our consent agenda. Do either of the commissioners want to remove anything from the consent agenda and move it to our regular agenda? Okay. Do we have anyone in the public who would like to remove anything from the consent agenda?
We don't have anyone here at the courthouse.
And I don't see anybody raising their hands in the Zoom.
Thank you, Sarah and Jill. So I would move to approve the consent agenda.
I second.
All of those in favor say aye.
Aye.
I guess I should give you an option to disagree with it, but seems like we're all in agreement.
Passes 3-0.
It does not look like we have anything on our regular agenda, so we can move to appointments.
Commissioners, this afternoon, I know it was late notice, but you did receive a notification from the Food Policy Council, and there is a designated spot on the Food Policy Council for a member of the public health, our public health department. That has been recently vacated, and they have suggested someone to fill that unexpired term and then would be eligible for a future term. And I can pull up her name.
It's Laura McCullough. I'm happy to make the nomination. I just want to make sure, unless we're not ready, we want more time to talk about it or think about it or research it.
I am happy to move forward with your nomination if you're ready to make it, Commissioner Kelly.
All right, so I'll make a motion to approve Laura McCullough, Community Health Planner for Lawrence Douglas County Public Health, to fill the Lawrence Douglas County Public Health Liaison on the Food Policy Council.
I'll second that motion.
All of those in favor say aye.
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 Fantastic. Do we have any additional appointments? Or special appointments? Okay. I think that brings us to general public comment. Sarah, has anyone joined you in the courthouse in the past few moments?
Nope. We have no one here for public comment.
Jill, is there anyone online?
I'm not seeing anyone.
Thank you. We will move to Commissioner and Administrator Miscellaneous. Sarah, what miscellaneous items do you have for us this evening?
Thank you, Commissioners. I've got a few, and I'd like to start with a brief presentation from Little Government Relations. Our governmental relations firm is working with us in Topeka, and so I'd like to introduce Stuart Little and Mallory Lutz, who have joined us here to give us an early legislative seasons session update. And I guess you have a copy, there's a copy of their latest update in our packet, and commissioners received it earlier this week. And I'll just turn it over to you, Stuart, to tell us how things are going.
Well, thank you. Can you hear me okay? Okay, great. We love being a miscellaneous item, so thank you for sticking us in there. Thank you, Madam Chair, and welcome new commissioners. We enjoy the opportunity to get to work with you. And we appreciate the chance, and please feel free to reach out and make sure that Sarah and your staff know what you need from us as we go forward. In addition to myself, Mallory Lutz is my associate, and we've been covering the issues going on in Topeka. We're going to give you a kind of a super high level look here briefly, and you have a written report, and we're happy to respond to any specific questions you might have. In general, this legislative session is unlike any other, incredibly disrupted, making it very hard to participate in hearings, to do advocacy work, to deal with all of the regular day-to-day things about getting our issues addressed. Just because of COVID, it's taken at least 2 weeks to get legislative committees to deal with the virtual online hearings, and that's been a challenge. Some of them are working well, some of them are not. So it's also a matter of it's hard to get information around and testimony posted. So normally we would have testimony. So a lot of those kinds of challenges, but one thing I would focus on, a couple of issues are making their way through very quickly because they are priorities for legislative leadership. And they are tax policy. One of them is the tax lid, which I'll repeal, which I'll talk about. There's a large income tax bill that's making its way through. The abortion constitutional amendment, which has already passed the House. It's going to be on general orders in the Senate tomorrow, up for debate. Some changes to the Emergency Management Act and local county health department authority. There's a big battle brewing over K through 12 education and non-public schools. Those are the ones that are the priorities. So that's going to take a lot of the time and energy. So there will be a lot of things that will get introduced that will not necessarily advance this year. I'd talk briefly about legislative tax issues. The tax lid bill should be it's passed the Senate, should be on final action in the House or final committee action next week. Essentially, as you all are aware, and it's in our written report, it removes the tax lid that we've been living with for 5 or 6 years, takes that off the plate. And what it does, however, is it does elevate the importance of the amount of revenue that you collect. The tax lid was a lid on your mill levy. Now you will be required, as you are always required, to do a public vote and have a hearing on your budget. You will be required to do the same thing. There was some mechanical procedures that will require all of the taxing entity information to be compiled together, and then you would have to make a vote, even if you're just including collecting with your levy the new increased assessed valuation, which is always a part of what you all have to do anyway, but we'll just kind of elevate that and make it more significant and not have the tax lid. There is a bill that's beginning to make its way through, and there are a couple of property tax bills, but one of them of particular significance would be the potential for a property destroyed or damaged by a natural disaster to be abated and taken off the tax rolls. And had that been in place, there might have been some pretty significant impact from just a couple of years ago on you all. So that's something, if there's a hearing, that'll be worth paying some attention to. The other big tax issue out there is an income tax issue. Folks that have been watching that in terms of the bigger picture of state revenue and what's in the state budget to fund some of the programs that the county has responsibilities for, is there's an income tax bill that has the potential to take about $600 million out of the state revenue plan over the next 3 years. This is a bill that's been vetoed by the governor twice, or been vetoed by the governor 3 times and failed to override it 3 times. It's coming back again this year. It has some conforming Kansas with the 2017 federal tax changes and a couple of other policies. It's mainly significant in what it might do for the revenue that's available for the state to fund mental health, public health, those kinds of issues. So we're watching that as well. I'm going to pause here. Mallory's going to talk about a couple of other topics, and then we'll kind of wrap up and be happy to answer questions.
If anyone wanted to ask any questions before I move on to some different topics, please feel
Sure.
free, or we can wait till the end. So.
I do want to talk a little bit about the disaster property tax bill, Stuart, and please correct me if I'm wrong here. From at least from what I understood, the legislation currently we have legislation in place, and we used it during the May 2019 tornado that hit Douglas County for houses. This would expand it to the entire property, so outlying buildings, barns, accessory units, commercial structures.
Yes.
And so I don't want anyone in the public to think that we had property tax disaster relief in place in 2019. This would be an expansion. The part that's particularly difficult about this legislation is it would be retroactive back to a certain date, I believe, which would include the May 2019 tornado here in Douglas County. And I am very confused as to how I get tax dollars that have already been distributed to cities, townships, and get them back and give them back to taxpayers. So I think particularly some of the retroactive aspects of this legislation are going to be particularly hard for us to implement. But obviously, this is a program our appraiser was very engaged in after the 2019 tornado, and the commission approved those applications, and we continued with this process. But specifically, if it's still got a retroactive nature in it, it could be really just difficult for us to work with.
It is retroactive back to 2016. So, and it's scheduled for hearings next week.
Thanks, Stuart.
Okay. Are there any other questions before we moved on to Mallory? Okay.
Yeah, Stuart, how did they decide 2016? This seems like it was a very specific incident. They're trying to get property tax refunds for.
I would suspect if we did the little research, we would probably find some event that someone wanted covered in 2016. I don't know if that's back when we had some of the fires. I don't know it could be, I think, something like that. I would suspect that's part of the logic. That's an interesting sleuthing task we may take up to see what that would be, though.
And my other quick question, and it was probably in there, but I missed it. There's an abbreviation of LKM in your update that I tried to find what that was for, and maybe somebody else figured it out. I couldn't figure it out.
It's for the League of Kansas Municipalities.
Okay, thank you.
So we'll be careful about that. I'm sorry, we get used to talking to each other, and we need to keep remembering. So thank you for that.
I'll move on and I'll talk a little bit about a couple of kind of local control related issues. Last couple days, we have had hearings in Senate Utilities on the Energy Choice, Senate Bill 24, and you're probably familiar with that. I know Jasmine, we talked to her last week, and Douglas County submitted testimony in opposition. This, of course, prohibits municipalities from imposing restrictions on customers' use of energy based upon the source of energy. So proponents of the bill, of course, were the various natural gas companies, then the NFIB, Kansas Restaurant and Hospitality Industry, a couple of local chambers, Americans for Prosperity, and several others that submitted written proponent testimony. Opponents, of course, included the League of Municipalities, Climate and Energy Project, Sierra Club, some sustainability groups. So the committee is planning to hear or to work the bill tomorrow. There may be a couple of amendments to clarify a few things. We need clarification that this doesn't prevent a city to make these types of decisions about their own buildings, that it wouldn't prevent them from doing that, and potentially an amendment addressing how franchise fees fit into this based upon how the language is written. Briefly, also on Senate Bill 14, I know Stuart touched on this a little bit, the Kansas Emergency Management Act. This extends, Senate Bill 14 in particular, extends the emergency declaration to March 31st. I think this may have been the quickest I've anyway ever seen a bill get through both chambers and get to the governor's desk in like a week, it felt like. So we now have a couple of months to talk about, issues of local authority, how county orders interact with state orders, what penalties and enforcement of those orders, as well as legislative oversight during states of disaster, and looking at business closure policies as well. That's been something that lawmakers have talked about a lot when it comes to the Emergency Management Act.
Yeah, I would mention one thing to just the bill that's passed, that Senate Bill 14 is an extension of everything basically that's been in place to buy us 2 more months here in the legislature to get everything resolved. So the final resolution of local health, all that's still to come. So yeah, just to be clear.
Thank you for that clarification. Also want to talk a little bit about criminal justice reform. I know this is something we talked a lot with you all over the interim and kind of preparing for what we thought would be some extensive discussions this session, but that hasn't really come to light yet, just with everything else going on. There, to my knowledge so far, there's only one bill from the Governor's Commission on Racial Equity and Justice that's been introduced so far. I know Commissioner Portillo can correct me if I'm wrong on that, but it's a bill that would require newly certified law enforcement officers to attend diversity meetings, and that came out of your recommendations from the commission. A couple of other smaller things we're watching. I know maybe Pam had mentioned it at one point, but keeping our eye on the extending terminal release, the compassionate release program from 30 days up to 120 days. So I know the Department of Corrections, that's not necessarily a big impact on people, but it's a handful of people every year that with the extension that would impact now. So that actually got out of committee today. So that will be going to the House floor probably sometime next week. Lastly, I just want to mention we've had some brief conversations about race and equity with some policymakers, and it's kind of been suggested to us that legislation is really what's needed to encourage discussion at this point. I know, Sarah, we talked with you and a couple of other folks at the county about perhaps having the county share with some committees the data and research you all have been doing on disproportionate minority contact and some other topics. But at this point, just based on the conversations we've had, in order to kind of have any meaningful discussion about some of these issues, it's really going to take a bill at this point, I think, to do that. So I'm happy to take any questions on that, but I believe Stuart's going to just briefly touch on some funding issues, and then that will kind of wrap up what we have on our agenda. But let me know if you have any questions.
Before we move on from some of the criminal justice discussions, I did see that there's discussion about suspending the right to a speedy trial, and I was happy to see in your report that this doesn't look like it has much support, but can you tell me a bit more about kind of where we're at support-wise for that?
Yes, so there was a hearing on that yesterday, actually in House Judiciary, and there was some pretty strong testimony and support from prosecutors, obviously. So Mark Bennett, the Sedgwick County DA, provided some pretty extensive testimony and kind of what they're dealing with specifically in Sedgwick County. He'd done his research and talked a little bit actually about Douglas County and in terms of the pending jury trials that counties are facing. I think he mentioned that you all have about 150 to 170. Others that testified, Sheriff Easter from down in Wichita, a Franklin County attorney, who also serves as the president of the County and District Attorney Association. Just a few opponents, the ACLU and the Association of Defense Attorneys. There was no indication from the chair of the committee that this would be worked anytime soon. I know the real heartburn of it is that not only are they suspending the requirement for, kind of during this period of COVID, but that you would suspend it going forward. And I think that's where the heartburn is for a lot of the committee members. So, this could be a case where they move forward on that, on the kind of the COVID piece of it and maybe suspend it for the next 2 years or something. Because a lot of people think 3 years maybe is too long. So if you were to maybe suspend it for 2 years, but I don't know if the piece about suspending it going forward completely will, maybe that wouldn't be included. So we'll keep an eye on this. But that's kind of my feeling after the hearing yesterday.
I think it cuts many different ways, and it kind of has the feel of something that we have a hearing, we get some of these issues out there, and then gosh, we just don't have enough time to get it done this session. Because I think it does cut many different ways here in the State House, depending on who you're talking to, I think. So real quick, I'll just wrap up the budget. The state's budget is not as in dire need as we would have believed 6 months ago. We, in the original estimates, were anticipating a tremendous loss of revenue. It is not as bad as we'd anticipated. The governor's budget is still tight. She's put some things in her budget to try to manage costs and keeps costs down. We don't need to get into details of that. We can, but I think in general, for example, the funding for the crisis center is in the budget and is making its way through. Again, budget hearings will start on that next week on the governor's budget. There's been some new money kicking around for mental health. I don't think there's the various state agencies that we would be working with for programs, IDD, community, and those kind of things. The budgets are flat. There was a raise that was taken out, rate raise that was taken out, but those are all making their way through the process. We don't anticipate any significant budget issues, and that the crisis funding is tucked away in there. And maybe the last issue we would note is that the Peasley Tech tax bill was introduced today. It was an earlier version introduced, but this one was the correct one. It was introduced today. No hearing scheduled yet, no bill number, but we'll keep that on our list as well. We'd be happy to answer any questions if you guys needed anything else.
So I know that higher ed budget's not necessarily something that's direct to the county, but it is one of our larger employers. And it's something that has come up quite a bit recently in discussions in our community. Do you have a sense of kind of what's happening around the higher ed budget?
You know, other than, we haven't started the budget process, so we don't, I don't know that I can speak, or either one of us can speak very deeply about this, just because we haven't got into the budget process, but we're seeing all the kind of same things coming out from the university, that in terms of cuts and some of the issues that they're having to wrestle with. So I think once we get into those budget hearings, we'll make sure that that's part of something we share with you all, what we've got on that.
Thank you. Do we have any other additional questions, Commissioner Reed or Commissioner Kelly?
No questions, but thanks for all the details.
Sure, thank you very much.
I want to thank Stuart and Mallory for being a part of this, and we have it scheduled for them to come back kind of halfway and then towards the end as we approach wrap up. But if at any point in time, you know, I just really appreciate how accessible Stuart and Mallory are. So if there's any point in time we want to see if they can pop in for a Wednesday update, we can certainly reach out to them to do so. So thank you all for being here tonight.
Sure, thank you.
Thank you.
There's a couple other things from my memo that I wanted to point out. Attached in the memo, there is an updated information around Douglas County's work with the Kansas Leadership Center. For the third consecutive year, Douglas County has received scholarships for commissioners, staff, and advisory boards to attend leadership training at the Kansas Leadership Center. So this has been a really important program for Douglas County, and we've put a number of people through this work. And so I'm pleased that we have this opportunity to again move more folks through it. And so obviously, if it's something you're interested in, or if you have thoughts on who we should recommend to attend, please let me know as we go forward with that. And
so
then, go ahead.
I was just going to say, I love that we have this opportunity for folks, and I really like that it includes participants on advisory boards. Yeah. How do we get the word out to individuals who participate on advisory boards?
So each year, once we know that we have it, we have circulated it to the coordinators for each of those boards. Many of our advisory board members have already attended. We will do so after this announcement and make sure we reach back out again to see if there are other folks that just hadn't had an opportunity to do it yet, and see if we can get additional folks to participate.
Sarah, I would only add that there's some research that's coming out of the Kansas Leadership Center on, how many leadership sessions it really takes to make a difference within your organization. And if we can think about, not just them attending your Leadership Edge, but going to that second level, that's a cohort that's 6 days. And I just think I can share some of that research with you, but it may be helpful to share with those who have attended before because the scholarship can cover them attending again, to take advantage of those programs as well. And especially if we can find something, it may be our equity work, that we're really trying to use that leadership work to focus on. I think the information that Megan Spreer sent us, Megan Spreer sent us, did I get that name right? No. Michelle Spreer, yes, sent us today about the GARE survey, I think might be a good place to jump off from. So just a suggestion there, and I can send you that if it would be helpful.
It would be, I appreciate that. Yes, we have sent folks to level 2, but obviously it's one of those things that we need to keep encouraging with the additional higher trainings that they have. Also, we've had some conversations this week about how we could perhaps engage the Kansas Leadership Center in some conversations about our equity work. So I think you will be hearing about that as we move forward. So I'm real excited about those opportunities. Moving on slightly, I did want to point out that we have a work session next week, which will be, the Sheriff's Office will present information related to deferred maintenance needs at the Douglas County Correctional Facility. And then after that, we have a presentation on Tier 2, on Tier 3, cluster development in Tier 3. So we're beginning to really get the work session scheduled for February and March. I want to point out too as well, and this is really hot off the presses, and if I need to, I can perhaps have Mike Brower come over and talk. But just today, Douglas County found out that we, through SAMHSA, which I always get the acronym wrong for what SAMHSA stands for. So I'm going to read it so I'm right. Substance Abuse and Mental Health Service Administration at the federal level. Douglas County was selected to be one of 4 counties nationally to reimagine substance abuse disorder systems, along with Niagara County, New York, Fargo, North Dakota, and San Diego County, California. Georgetown University and New York University are managing the project, and Mike Brower and Bob Tryansky from our team have been meeting monthly on phone calls related to this since November, along with Sandra Dixon with DECA. And we found out that phase 1 was approved for funding through the Arnold Ventures, and we're going to be submitting a letter of support for that work. And what that would mean is this would launch in March, and the Georgetown and New York University team would update a project vision based on conversations and develop a plan with benchmarks and times with the participants. The county would provide names of thought leaders and organizations and service recipients who would be participating in guiding the principles. And then Georgetown would submit a grant application for, I'm going to get this real wrong, JoinCon JRIG grant to support phase 2, which would fund mapping funds and programming in each county.
Do you mean JCoin?
JCoin, yes, that's what I mean.
That's a great project.
Okay, so yeah, and maybe you know what JCoin stands for. I do not.
I'm not going to try to pull that acronym off of the top of my head.
Great, but it's a really exciting opportunity, and I wanted to share it since it was sort of hot off the presses, but we will be continuing to explore that and highlight that work with the commission. And I believe, commissioners, that's all I have for you tonight.
That's wonderful. Commissioners, Commissioner Reed, Commissioner Kelly, any miscellaneous items?
I'm hoping we'll talk a little bit about vaccine distribution this evening. I don't know if that's an item either commissioner wants to talk about, but maybe Sarah, you could give us a bit of an update just on what you know.
Thanks, commissioners. I'd be glad to. So I think the important conversation when we start talking about vaccine distribution in Douglas County is that our estimates for phase 2 is that 40,000 Douglas County residents qualify for phase 2 vaccine. Our current distribution amounts are less than 1,000 a week. So at that rate, it will take a significant amount of time to move through phase 2. That being said, we have all hope and belief that the amount of vaccine will increase to our community. When the governor announced the opening of phase 2, Douglas County was not completed with phase 1. And we've had a lot of media coverage about this issue. We were still trying to do our best to make sure that phase 1 participants had received their vaccination. In addition to that, even in that process, there were some late additions and changes related to phase 1 that made it really difficult to pivot and make sure that everyone was included in phase 1. Now, the beauty of this is it doesn't stop phase 1 and start phase 2. Phase 1 blends into phase 2. People are being vaccinated today in this community for phase 1, as well as preparing for, we've begun phase 2 distribution as well. So we encourage folks that are in phase 1 to continue to reach out to the health department to complete vaccination interest forms and to help and hopefully we can continue to get those processes done. Specifically around vaccine interest forms. The county, I'm very proud of our staff and what they have done to help assist the public health department and ensure that we have updated information available to the community on how people can submit their interest to receive the phase 2 vaccine. So there is a vaccine interest form on our coronavirus hub. Once an individual completes that, they will be placed into a system where they will be notified by either phone call, text, email, whatever they prefer, when their particular group in phase 2, and we are affectionately referring to them as buckets, because we were told not to call them tiers. So we're calling them buckets inside phase 2. So when their particular bucket, when we have vaccine for that particular bucket, they would be notified. At that point in time, they would go online, complete their pre-registration screening tool, which is going to ask them a lot of medical questions and emergency contact type information. And then they will be contacted when there is an appointment time available for them to have them. Some of those notifications and those codes are coming out particularly for folks over 65 that process. LMH Health has partnered with us to help do that work in our community. And they are already reaching out to folks earlier this week. Over 1,300 individuals in the over 65 age group were contacted for participation in those groups. So we're beginning to vaccinate people over 65 this week in this community. And then there's a larger scale mass vaccination at the fairgrounds planned for Friday. Moving forward, I think all over 65 vaccinations will be managed by LMH Health. The remainder of phase 2, which includes local government, public safety, essential personnel, all K-12 educators in Douglas County, early childhood workers in Douglas County, grocery store and food service workers in Douglas County, transportation and other high contact retail and other high contact businesses in Douglas County will be managed by the health department with the assistance of Heartland Health and providers at KU School of Pharmacy, which are all stepping up to help participate in our community. And then we really hope that as more vaccine becomes available, more providers will come online and assist in that work. I should have mentioned, and I need to, is that also congregate living sites are included in phase 2 as well. So that not only includes the Lawrence Community Shelter, any remaining long-term care type facilities that were not taken care of in phase 1, and the Douglas County Jail are included in phase 2 as well. We know that this process has been frustrating. We know that it's been really amazing to see how much how much interest and excitement there is about getting this vaccine in our community. We really ask for patience as we try to deal with the supply and demand issues here in terms of how we approach it. We are looking to mobilize additional assets to assist our community in signing up and completing a vaccine interest form. Senior Resource Center has stepped up and is really is taking phone calls and registering seniors that have trouble accessing any of these online forms, and they're serving hundreds of people a day. They're taking volunteers. So if folks are interested in volunteering and helping seniors, prepare those forms, I know Megan Poindexter at the Senior Resource Center would love to have additional help. We also have folks at the Lawrence Public Library that are assisting folks in getting that vaccine interest form completed. I know we need to do more. I know it's going to take more time to do that. And we've also had conversations as well about how we can assist with transportation issues. That form does ask for individuals to indicate if they have transportation barriers that are going to prevent them from going to a mass vaccination site. So once that data is in the system, there can be a more targeted approach as to how to best serve those folks. We had a town hall today with county employees about vaccination. County employees are in all 3 phases of vaccination. So we're looking to share that information with our own employees about how that process will work. And Douglas County, as their employer, will help assist in that process and getting them in the proper phase and getting them vaccine as it becomes available for their phase. I feel like there's probably about a million more things I could say, Commissioner Kelly, about this. So I'm going to stop here and see if there's additional questions before I start getting into the more information than anybody wants to know about how we're proceeding.
I really appreciate all of that background. I think that there is a lot of excitement around the vaccine, a lot of frustration, and a lot of confusion. There are a lot of collaborating organizations and collaborating agencies. Can you help just kind of help us all wrap our minds around exactly how the county fits in, how the health department fits in? How do all these agencies work together?
I'll do my best. And I think that's been one. It is obvious. It is a complicated process, and the best way I have come to explain it is that if any organization in Douglas County has some sort of federal tie, they are likely received vaccination doses and have the ability to distribute themselves. So, for example, Haskell Indian Health Services, which is tied directly to the Bureau of Indian Affairs, receive their own doses of vaccine and have the ability to distribute them to their patients. If you know folks that are associated with the Veterans Administration in Topeka, but we have a lot of veterans, that live and work here and staff that live and work here, they receive their own allocation directly from the federal government. Douglas County isn't necessarily in the loop on all of those. There's not a central clearinghouse of information in terms of how the amount of vaccine being distributed. Similar situations are true for long-term care facilities. The state managed them through the Centers for Medicaid and Medicare and issued contracts to CVS and Walgreens to go into facilities to do those. We've been working to try to get information to make sure that process is happening. It's not automatic, is what I think is important for the public to understand, is that it's just not automatic. I would say that's in terms of what's coming to us. Once from us working together and moving out, there's a vaccination planning committee that's working very hard under unified command to help plan for how that vaccine will happen, and then how to kind of check themselves, review the numbers, review the data, make sure if someone missed a dose, how do they go back and contact that individual? All of these logistical questions that will come about in this process that we will be living with for the next several months as we try to roll vaccine out in this community. It is a giant logistical challenge. And it is something that we as a nation have not done, at least in 100 years. So I'm really proud of the folks on our team and in our community that are working hard to get this pulled together and done effectively. I do think, you know, we ask patience and flexibility. We're going to make mistakes as this process goes on, and we're going to just do our best to learn from them and try to continue to move forward, to do our best to get it out to the community. I would say that, so that group right now really is led by the Health Department, Heartland Health, and LMH Health, but we have involved the pharmacy program at KU and Watkins, community. Watkins Health Center will be heavily involved in phase 3. And so I think additional providers will come on board as more vaccine becomes available, and then we can push it out quicker. So right now, not all some of those folks are in the loop, but they may not be attending every meeting just because of the phased focus to try to get this work done inside phase 2. Does that kind of answer your question, or did I miss the mark?
Oh, it did. Thank you. Commissioner Kelly, Commissioner Reed, do you have any additional questions?
I don't think I have any questions. Commissioner Reed here. I just had some comments that I wanted to make. And Sarah, thanks for giving us a photo of the landscape today. And with the knowledge that the landscape is ever changing and that there's a tremendous amount of moving parts. And I'm really hopeful that some movement and momentum will happen at the state level so that we start seeing more doses and we are able to better match the demand with the supply that we're getting, because I think that it's clear and evident that there's a high demand in our community. So I just wanted to make special note and thanks to county staff who really hustled last week in response to what was a perhaps, I mean, just a little, I'm trying to think of the phrase that Hank Booth used on the radio the other day, and I forgot it now, but you know, it was a little convoluted and people had some valid reactions and feelings in response to that initial rollout of 500 appointments for the mass event on the excuse me, Friday, January 29th. And those are valid concerns, and I'm really grateful to the people who raised the concerns and shared their experiences. And I'm super impressed with and grateful for all the county staff who worked in a tight turnaround to create that form, that interest form, and reassess what wasn't working and make sure that we improved upon it to the best of our ability, and think that there is a general spirit of constant reassessing and trying to evolve the system and the process to be more equitable and more accessible, and that it's more clear. So I appreciate that. And I think that these conversations are important to just keep talking about what we're learning and what we're improving upon, kind of where the gaps are. So thank you to everybody who did work on that. And then I also just want to encourage the public and people who may be watching or who might watch later to really figure out what capacity you have to support people that you're in community with, whether that's your family, your neighbors, your coworkers, whoever it is, you know, taking care of yourself and your own family first and foremost, of course. And if you have the capacity to contact people that you know that may not know about that interest form or don't have computer access or struggle with technology, offer to help them fill out that form, connect them with the Senior Resource Center if that's a valid resource. Talk to them about making sure they have a plan for getting to their appointment once they do have one. So I just want to encourage mutual aid in the community and for folks to really look around and see who they can help with those steps of the process so that we can just keep increasing the capacity that the entire county has to get this done as quickly and efficiently as we can.
Commissioner Reed, I really appreciate what you said there at the end, that, you know, we have to take care of each other. We tend to sometimes lean on government to do that. And this is just such a massive task. And Bob Tryansky talked about it today at the Douglas County town hall meeting, you know, that probably the best way that we can share information is just to talk to each other, is just to share, call each other up on the phone, say, do you know about this? This is what I heard. I think sometimes we become over reliant on social media and online resources, and especially during COVID. You know, we don't talk to each other at the grocery store anymore, you know, and that's just the situation that we're in. So I appreciate you elevating that. I would also say, and this is, I'm sure, hard for the public to hear, this is a really hard process, and I'm really proud of emergency management and that team. I'm really, you know, the health department, we have underfunded public health for many, many years. And I have visited with many of them today, and I will tell you, they are working so hard. They are trying to get this figured out. And we really need to respect how long they've been working on this, how many long days they have put in, you know, not only with the vaccine, but everything that was before we had the vaccine, and we're still dealing with COVID cases. So I think, and even I have not been on my best behavior sometimes in talking to them and recognizing that the work that they've put in, if each member of our community had 5 minutes, and I don't suggest you, but to spend with our emergency management people to walk through what a pod site looks like for vaccinations, you would have a whole new appreciation for all the details that go into it. I'm fortunate we didn't have a situation. It was very unfortunate in Johnson County, what happened there with people waiting outside we haven't had that yet. And I think that's because in some ways I don't want to say we've been cautious, but we've been very thoughtful about how we're trying to distribute the vaccine. And in doing so, I can understand how people might be frustrated. It's not fast enough. It's not exactly the way we want it done. I'm saying that in the hopes that people will understand that there's going to be learning that goes on through this. There has been throughout the entire pandemic, and we'll get better at it as we go. I think we need to think about how we communicate all these things. Please look at the the coronavirus hub. Please go to that. There's great information there. But also, I think we need to also consider how we're communicating with those people who don't have internet access. Word of mouth is great. Can we print more materials? I know that's all things that we're thinking about there, Sarah, and I appreciate it. And just like Commissioner Reed and Portillo, I appreciate people bringing concerns forward, as long as they're being respectful for the work that's being done so far. And I think that's what we're looking for. So the concerns are valid, and really appreciate them. We've got people who are just working so darn hard on this. Sarah, it looks like you're going to jump in, and please interrupt me. Yes.
I did want to say, yeah, one of the initiatives coming from the Senior Resource Center was, we're looking at a postcard mailer that would be physically mailed to people's homes and make sure that it could have information about contacting the Senior Resource Center and a phone number if you need help making sure that information is available. Our equity advisor team is talking about how we can make sure this gets to specific communities and in different languages with perhaps some train the trainer type situations. So if, folks could, go into someone's home safely and help, or talk on the phone and gather the information needed to put their information in the system for them. So, I mean, we're still working on this very hard on a regular basis to get additional information out. Earlier, since last week, one of the conversations that I wanted to bring to the commission to talk about was, if additional advocacy needed to be done from our perspective to the state about increasing the amount of doses. I will tell you, I'm sometimes, I'm not quite sure, what the best route is here. I do think the state is, there have been national news reports about the amount of vaccine that's come to Kansas overall. that, you know, I think our state administration is doing its best to do what it can to distribute it. I know they are looking at how distribution worked from phase 1 into phase 2, because you are dealing with 105 individual counties as to how to approach this. It is a very tough issue for them to manage. So part of me wants to extend grace to them to kind of continue to work through this process. But, you know, at a certain point, the citizens of Douglas County expect us to sort of advocate on their behalf. And I do think it is, it doesn't seem equitable at times as how vaccine has been distributed. We can't find necessarily a pattern in, you know, if it was, you know, necessarily more urban versus rural or different things that honestly, we haven't had time to do that kind of research to determine. But I did want to raise that issue to the commission and know that it was discussed at Unified Command. And, you know, if there's additional conversations you want me to try to explore or you want to have regarding advocating for increasing doses and capacity.
Sarah, I really appreciate that. And I think that what I'm hearing is that this is a constantly changing situation and things are updating really, really quickly. I think as representatives of the citizens of Douglas County, I think that we need to recognize that things are moving very fast and we stand ready to jump in and advocate. I don't want to speak for the whole commission. I stand ready to jump in and advocate where you think it can be productive, but I also think that things are moving, things are changing, and I don't want to get in the way of how we move forward.
I would echo those sentiments, and I also stand ready to advocate, but I want to make sure that it feels that it's productive with intention, and that we really know where the ask needs to happen and what the ask is, and otherwise that it is our jobs right now to really keep the focus on how we are managing what we do have, while also making sure that the state hears that there's an increased demand. And so, yeah, I agree with Commissioner Portillo that things are changing so rapidly that there could be a lot of new information for you and Unified Command to share with us in a week. So it's a conversation that we can continue to have.
I think we owe it to our community to have the same grace and patience that we're asking of them. And certainly we all would like to have more vaccine and we'd like to be able to distribute it as fast as possible. And we want to point at somebody else to say, you're not doing what you should be doing. But if we don't have any evidence, as Sarah said, we haven't been able to find any pattern, that's just frustration. That's not really advocacy in my mind. I think that's to give it a focus, to say, this is what we noticed. Can you tell us why this is happening, would be a much better approach than just stomping our feet and saying, we need more, we don't have enough. So I'm fine waiting and you know, would encourage us to stay talking about it and paying attention to it, which I expect we all will.
I appreciate that, commissioners, and I think that's definitely the right response for now. And obviously, it's one of these issues I'll keep you all updated as we continue to learn more. And absolutely, as Commissioner Portillo said, this is an incredibly ever evolving landscape as to how to approach things moving forward.
Sarah, thank you for all your work on this. I know you're taking many tough calls and having to motivate staff in ways we probably never have had to do it before, and just really appreciate you and your team's work on this incredible challenge. It seems trite to say that now, but it's really not. It's huge. It's just huge. So thank you.
I think I just wanted to make one last note, which was I've noticed some chatter today about how the distribution of phase 2 will be going to, as you say, the multiple buckets, and that I'm really excited about the work that the equity team has been doing in Unified Command and really making sure that that's infused in every evolution of this process. And I just wanted to speak to the fact that I appreciate it's with an eye towards equity and not necessarily equality. And I think that those two words and ideas get conflated a lot, but equality is the notion that everybody has the same, and equity is the praxis that everybody has what they need, and that it takes some equitable distribution in this case in order to make sure that we can all move forward together, and that there is not a sort of value ranking system of who outside, who in phase 2 should get the first few weeks, that everybody in those buckets has the opportunity to get an appointment on a rolling basis, and that we're all going to move forward together. And I think that is an equitable approach. And so I just want to lift up that has been a piece of the conversation in Unified Command, and appreciate that.
I would just add, as we move into it, some of these processes will be done by employers. We'll make some of these choices. And, the further we get away from that work, not that they won't make the right decisions, but just know that some of those decisions will now be made at the employer level, not by Unified Command. And I think that's something just to keep in mind as they make those choices of what works best for their organization. And how to roll that out. I'm sure we'll get more details on that as they are determined. If we're ready to move off vaccines, I have another item just to bring up for miscellaneous here, if that's okay. I attended the Human Services Coalition presented the poverty work group's work, and tremendous appreciation for Jill Jolliker's work on that with the United Way. I am really excited about what they came up with, and think this commission will be very interested in reading that document. And I am sure we'll be hearing about it soon from Jill and that team, and would encourage everybody to take a look at the work that they're doing. It's neat to see our human service partners come together across the county to talk about what strategies, what's possible, how we might move forward. It's the health equity plan is great because it illustrates where there are gaps, but how we move forward and what with intentionality is I think what was missing, and it's so great to see that happen. So I share that with other commissioners. What great work our county is doing on that to bring those the human service providers on that team.
Just as a little bit of background, the anti-poverty group is working through the community health plan as a plank of the community health plan dedicated to studying anti-poverty issues. So this is their plank of the plan that they have approved by their and endorsed by the Human Services Coalition, which is their sponsor, which was the, I want to say sponsoring, but I think it was their coordinating body for it. And it's really exciting work. And a lot of this is work that is really at its genesis and start. Other parts of that plan, including food insecurity and housing and even behavioral health, which the county has a very active role in. We had a number of initiatives in play that could be wrapped into the community health plan and moving forward. There's a lot of heavy lifting at a very early level here on the poverty plan. So I look forward to getting it in front of this commission very soon, so you can see that great work. And I think Commissioner Kelly is absolutely right. You're going to be really inspired by by what's coming out of that conversation. So that's just a little teaser for what.
Thank you for the preview. Yeah, I'm excited. I was on the very beginning of that today, and then had some tech issues and couldn't get back on with the sound. But Sarah or Jill, will there be a recording of that? I mean, I know we'll have future conversations as a commission, but
Yeah, Leah will be sending those out. Commissioner Leah Roslin will be sending those out as a follow-up to the Human Services Coalition, the full group.
great. Thank you.
Yeah.
I have no miscellaneous items to add. Thanks for the good conversation, everyone.
Fantastic. Commissioner Kelly, did you have anything else? Okay. Well, thank you. I do really appreciate all of the conversation and all of the updates. And I'm looking forward to our future learning sessions that we have mapped out in the coming weeks. They all look like really great topics. If we don't have anything else for this evening, I would move to adjourn us.
Second.
All of those in favor, go ahead and log off.
All right.
Thank you.
Good night.